Well, and with that in mind, we are going to get right into our conversation with Dr. Andrew Ford, our dermatologist. He is the skin expert, and so he is the person to tell us what we're going to be chatting about today because I can't begin to wrap my mouth around this one. I can say probably
Melanosis.
one of the words.
Melanosis.
That one.
Yeah, just this one.
Good morning, Dr.
Hi,
Ford.
morning, Cassandra, Doug, and the
Yeah.
viewers.
So when in
This one's
doubt,
giving you
we
trouble, huh?
leave out. So
Guttate hypomelanosis.
that part was easy.
Guttate?
Yeah, guttate.
It's
Guttate
soft on the
melano.
last T.
Yeah,
Guttate.
yeah, guttate.
Okay, like okay.
What in
Yeah,
God's name is that?
well, guttate refers to something that looks like a teardrop on the skin, and hypomelanosis is a lightening of the areas. So this is a condition that appears as you get older, especially past 40, as light spots on the skin. They're usually between 1 to 3 millimeters in size, but
Okay.
can sometimes go up to 10 millimeters. But it's very common. A lot of individuals, especially older individuals, do come to the doctor wanting to get clarification about it. And you know, one of the big worries is it vitiligo because of the lightening of the areas.
Okay. Well, how is it harmful?
No, it's totally harmless. It is a condition that affects lots of fair-skinned females mostly, but in the darker race, as you get older, you find that it comes more often and it progressively gets worse.
What
It
triggers it,
tends
though?
to affect the limbs mostly, like
Right.
below the knees and the forearms.
I was
So
gonna
one of the
ask.
basic things, as well as being an aging phenomenon, it also has to do with some exposure to sunlight.
Okay. Is this what you tend to see along people's shin bones?
Yes, definitely.
Okay.
But some people along the shin bones do have vitiligo, a form of vitiligo.
Oh.
But when you see the discrete oval-shaped small ones, like just about 3 millimeters, as I mentioned, that one is guttate hypomelanosis. It tends to be spread out a lot too.
You talk about exposure to sunlight. What else will trigger the appearance of this condition?
Well, mostly it's just an aging phenomenon. Here you see the leg of an individual with numerous guttate hypomelanosis lesions. You notice how small they are. They're flat and they're lighter, noticeably lighter. So it can cause some concern because of the appearance.
If someone gets this and they're not 40 as yet, what does that mean?
Well, you may just get one or two, but as you become progressively older, you just get more of them.
Okay.
How do you treat them?
Well, actually, there isn't a really good treatment for them. The list is very long. And when you see a long list of treatment for a condition, it means that there's no really effective single treatment.
They're shooting in the dark.
And
Okay.
I think sometimes when you see lots of treatment, it has to do with misdiagnosis sometimes of the lesions because plain warts can look like that. Sometimes early pityriasis versicolor, or what people call liver spots, can look like it. And there are also some keratoses. Last week I talked about seborrheic keratoses, and most of the ones I showed you were dark ones, but you can have light ones as well that can be on the legs. So this one shows you someone with less. You had to pull the skin there. You could see them in the center, these little white dots in the center, not as significant as the last photo.
Definitely fewer. What body part was that?
Well, that was a leg.
Okay.
Well, it begs the question, though, for those who are concerned about appearance, what do you do?
Well, there's always camouflage that's in your armamentarium when all else fails.
Makeup on the legs?
Yeah, you can do tan, you can do makeup, you can wear stockings. There are things that you can do. But it doesn't only appear on the legs and the arms. I mean, some people can get it on the face and on parts of the body, but mostly the legs and arms are the most common areas.
Is
But
that, go ahead.
as I was saying, some of the things people do will be to apply a very cold liquid like dry ice to it, or you can use electrosurgery, like burning them. And there are also some laser treatments that you can try, but there's no single effective treatment for it.
Is that a temporary treatment as well?
Well,
All
it's
those things you just mentioned.
sometimes some of those treatments actually can make it worse. That's why we don't
Oh,
we
my.
don't try aggressively to treat the condition, because sometimes you may try to do something and it gets worse. Another close-up of someone else's leg that's showing the same changes. But as I said, it can occur on other places. And when it's on the face, then it's really a problem because some people can get it on the face, but it can run in families sometimes. You can have a relative who has it and you get more of them. I guess it's a big plug for for sun protection, but
Right.
women tend to get it on the legs more because they wear dresses. Guys usually wear long pants unless they're always in short pants, so that's why it occurs in women more. But as the years go by and you get older, you find that the number of men and women that get it tend to become equal.
I met a dermatologist once who suggested that it's a good thing to wear sunblock all over, besides the benefits of having over time a nice even skin tone.
I suspect
What are your
that would work
thoughts
if you're a nudist
that?
colony?
No, but just to so that, because people don't think of putting it on their legs unless they're at the beach, and from what you mentioned, it's the exposed areas that are usually affected more by this.
Yes, certainly. Well, if in areas where you wear clothing, there is some blockage of UV radiation
Yeah.
from the physical aspects of the clothes. But in areas that are exposed, you would need some sunblock if you're actively in the sun a lot. If you stay out of the sun, then you need it less often. But there's still some things you have to consider with sunblock. Some people can have allergic reactions to it, and there are other things you have to consider as well. Also reapplication. But if you're in a sun job, then certainly you have to do that. I thought I'd put this in. We had done this already, but this is another change that occurs in the aging skin.
Oh.
And these are some little cherry angiomas. They're also called Campbell de Morgan spots, little red spots. These occur more commonly in the truncal area, like in the center of the body, and also on the limbs, little red dots that get bigger. They really represent blood vessels that come through the surface of the skin, and they're there. That's another thing that's very common with the guttate hypomelanosis. So I thought I'd just show you a little bit of those as well.
Can
so
those
that
appear on the face as well, near the eyes?
you can have them in the scalp, you can have them anywhere.
Yeah.
The one place they don't occur is on the mucous membranes, which means in the mouth and
Or
the
nose.
private parts and that sort of thing.
Okay. All right. Do they itch or anything like that?
No,
or are
they're,
they just
they're
there?
asymptomatic, totally asymptomatic. They're just things that you notice. You reflect that 10 years earlier they weren't there, and then you start getting more, and they just get bigger and more numerous, and that can be very worrisome for individuals. But they can easily be electrically burnt off, or you can use a YAG laser to treat them, or a pulse dye laser. They're very easy to treat. So fortunately, with the little red spots, you can get rid of them very easily. But the white spots are a lot more difficult.
They'll be your friends, so you might as well embrace them.
Yes.
So do you recommend going to see the dermatologist just to ensure that there are nothing to be concerned
Yes,
about?
certainly
and then
there
just
are
bearing with
some
them?
things that can look similar, and as I said, you can be misdiagnosis really can be a problem. So
Right.
it's important to get some clarification and to make sure you're dealing with the right thing.
Well, thank you very much, Dr. Andrew Ford.
Now
Now
we
I
know
have a
what we
better
can
understanding.
do with this one
Doug has
right
one
there.
right there. Okay.
Okay.
Makeup.
They'll make up what happened.